Welcome to the NIOSH Directors Webinar Series. The series examines topics related to working hours, sleep, and fatigue. Today's webinar focuses on reducing fatigue-related risk, or that is, working safely while fatigued. I'm Dr. Imelda Wong, and it is my pleasure to serve as the moderator for today's webinar. On behalf of the NIOSH Working Hours and Fatigue Work Group, we are pleased to have you join us today with our featured speaker, Dr. Drew Dawson. Professor Dawson is internationally recognized for his contributions to the scientific community and to industry in the areas of sleep and fatigue research, organizational psychology and human behavior, industrial relations and negotiations, and the human implications of hours of work. He has worked extensively with the aviation, manufacturing, retail, entertainment, transportation, and mining sectors in Australia, and is a world-renowned expert on fatigue in the workplace. He has instigated fatigue management programs, developed shift work and fatigue policy, undertaken pre-employment assessments, and facilitated shift work education sessions. As director of the internationally recognized Appleton Institute, Professor Dawson oversees basic and applied research into the effects of shift work and sleep loss on health and well-being of employees. Basic research programs are focused on the interactions of the sleep and circadian rhythms, the effects of sleep loss, and the ways people protect themselves against fatigue-related errors. Just a quick disclaimer that the findings and conclusions of this presentation have not been formally disseminated by NIOSH and should not be construed to represent any agency determination or policy. For more information about this presentation, please visit the NIOSH Work Schedules webpage. Thank you for your participation today, and now I'll turn it over to our featured speaker, Dr. Dawson.
Thank you very much, Imelda. Welcome, everybody. I'd like to, first of all, thank Imelda for inviting me. It was a great honour to be asked to talk, but I did notice she waited till halfway through the organisation to let me know we would be talking at 4 o'clock, 5 o'clock in the morning Australian time. So there is a little irony here in that we'll be talking about fatigue while I'm at my circadian low. So, I would like to start off and say that what we're going to try to present today is a new way of thinking about fatigue. It is unashamedly radical, and it's the shape of how many organisations are starting to rethink fatigue, and most importantly, to shift the emphasis away from a focus on the working time arrangement and schedules. The origins of this historically are kind of interesting. Not in the recent bushfires, but in some very major bushfires. We were working with first responders back in the early part of this century. And one of the emergency fire crew commanders came to us and said, we've been working a long time. We need to get a bigger focus on fatigue. We're starting to see fatigue-related errors. What can we do? And as I had been taught by my colleagues over many years, we decided to talk to them, and we said, well, you can look at changing the working time arrangement, you could reduce the length of shifts, you could reduce the number of sequential night shifts, all the recommendations that you'll see in many of the regulatory agency guidance materials around the world. And we went through the talk, and then he looked at us and he said, well, that's no good, that's not going to work. And then there was a big pause. He says, what else have you got? And there was a very big pause at that point, and I realised, quite importantly, that for many organisations around the world, particularly those who work in emergency services or first response type organisations, the option of working less hours isn't always there. And that for many people in the world, we had not been particularly good at providing them useful information. We provided them a lot of guidance materials on how to approach setting a schedule when changing the schedule was one of the options that you had. And it's quite interesting when you go back and look at the scientific literature on this, you'll see that much of the literature comes from Scandinavia in the 50s and 60s. It comes from manufacturing, and it comes from a time where Dad worked and Mum stayed home and looked after the kids. There was a very narrow demographic profile. I think over the last 30 or 40 years things have changed a lot, and probably the way we start to think and manage shift work and fatigue might need to move along with that and to make some changes to reflect what is the modern workplace in the developed world. So the theme for today, and if you take away nothing more than that, is that this is a shift away from thinking about fatigue and shift work as a discussion about schedules and rosters and working time arrangements. And it's to admit what I'm going to argue has been fake news for a long time. There is no roster, there is no schedule that will get rid of fatigue. I don't care how many hours you do or don't work. At 4 o'clock in the morning, and I know that personally right now, you're going to be fatigued. So part of the challenge here as organisations is a piece of cultural engineering, which is to say, actually you can't eliminate fatigue if you have to work at nights, for example. You can't eliminate fatigue because sometimes your staff are going to be up with a sick child. So rather than a focus on pretending to each other that by putting the right schedule in place, fatigue will be solved, I think we need to acknowledge that fatigue is a ubiquitous hazard. And part of the challenge for us is to work out how to work safely when people are inevitably fatigued. And I know that's a radical idea, and I know that lots of people will go, you can't do that. I'd like to say after 10 years of trialling this in Australia, we're actually doing it quite successfully, and there are many, many organisations who have now shifted the discourse away from arguing about the schedule and the financial implications and the labour relations argument to one in which we increasingly focus on the working time arrangement as a safety issue. And the cultural re-engineering piece that we talk about with managers and employees and unions is about how to work safely whilst fatigued. But I'm just going to move on to the next slide here. And I'm going to do a couple of things, and I'm going to talk about them here. If we think about safety from a global perspective, many people now think about safety and hazards from a risk perspective, and that is the greater the risk, the greater my need to intervene and control the risk. But from that perspective, then you need to be able to establish the level of risk associated with a hazard. And it's very important here that we talk about this from a global perspective. In a lot of countries, and the US in particular is one of these, risk means the likelihood. But for most of the rest of the world, this is not the case, and I'll go on and explain that a little bit more. But first of all, I'd like to put a challenging idea forward first and say, from a safety perspective, I don't really care whether you're fatigued or not. I care whether you create risk or not. And in many cases, we only think about fatigue in terms of, do the hours make you tired? But what we really need to do is to also look at the nature of the job that people are undertaking at the same time. And as you can see from the slide up here, it depends what you're doing as to what the level of risk is. So I could be really tired and operating a photocopy machine, and frankly, the risk is low. I may fall asleep on the photocopy machine, I may get 2 copies instead of 1, I may get a paper cut. But at the end of the day, the risk to the individual and to the organisation, despite the apparently high levels of fatigue in this poor woman, aren't of much consequence and therefore are probably of little concern. On the other hand, as we look into other types of jobs and tasks, the level of risk can vary from trivial to catastrophic. So for example, in the top right, we can see that a tired individual operating a vehicle could potentially lead to a fatality of 1 or more people. If we have somebody operating a 747, as in the pilots in the bottom left, then we could have hundreds of people die as a result of a fatigue-related error. And sometimes, and this is particularly the case in organisations that are in emergency services or first response, sometimes the risks of not working, that is withdrawing the service, can be more dangerous than the risks of continuing to work. And this comes back from some work we did years ago when we were looking at the long hours of work that many medical professionals work in Australia, and sometimes they can work up to 36-hour shifts. And when we went out to the community and said to them, how many hours do you think a doctor should work? most of the community thought somewhere around 12 to 16 hours was reasonable. The difficulty was if we did that, there wouldn't be enough doctors to go around. And so we went out to the community and asked a slightly different question, which is, would you prefer a tired doctor or no doctor at all? And generally, most people were quite happy to say a tired doctor would be fine, because even though they are tired and their likelihood of an error is greater, the risk to the patients, and whether this be doctors or ambulance or firemen or emergency services, utilities, sometimes the lack of service provision as a consequence of restricting hours of work can produce a greater risk to the community. So it's important here that we shift our emphasis away from talking about fatigue per se to one in which we think of the interaction between fatigue and the task, and that we establish both the likelihood that an individual will be fatigued and the consequence of a fatigue-related error in that job. And sometimes, as I said before, a tired doctor or a tired firefighter is better than nobody at all. And the risk to the community can sometimes be more profound from withdrawing a service. And we live in constrained times. Emergency services in the developed world are always understaffed. They're always under-resourced. I know it may seem like giving in to the inevitable, but sometimes you have to deal with the world the way it is. So what we're going to be talking about for the rest of today is what do you do when somebody is fatigued, and then how do you evaluate the risk, and how do you determine the best way to manage that risk without necessarily withdrawing the service. Now, while this was evolved and developed primarily from people working within the emergency services, first response, defence environments, we've actually found that this applies equally well in many organisations. Sometimes for operational reasons you have to work the way you have to work. And in those situations, separating out the safety consequences from the labour relations and union management negotiations can be quite helpful. Sometimes you have to work certain hours to get a job done. Here what we're saying is, well, let's acknowledge that there is some risk associated with it, and let's think about the controls that we can put in place to manage that risk. So if we move to the next slide, I'm going to suggest that there is an emerging regulatory framework around the rest of the developed world. There's been a little bit of this in the US, particularly in the transport sector and most commonly in rail and aviation, but a shift away from strict prescriptive regulation to one in which we have a focus on the level of risk. And there is a general framework that says, let's look at the working time arrangement that people are undertaking. Let's undertake an assessment of the likelihood and consequence of fatigue-related error, assess the risk, and then what we find is that generally around the world we'll find that people then classify the risk into one of four categories. And I've tried to stylise this here in this diagram. It says if it's green, i.e. if it's in a low risk context, that is either the consequence of the task is low or the people aren't particularly tired, then generally it's a simple schedule, put the schedule in place and get on with it. But as we move into other environments, we start to see that the risk associated with the working time arrangement goes up, but it goes up in a graded way. So as you move further from the centre of this circle, we see a yellow zone, which means that there is a moderate level of risk, and that as a consequence of that, we need to put moderate controls in place in order to balance the risk. As we move further away and the risk gets higher into the orange zone, then that says if you are going to do that, the risk is high and you need to have a lot of controls in place in order to continue doing that. And finally, there will be some point at which you say it's an emergency service, or in some case, continuing to work is important, but it can only be done under emergency situations. And that could be some catastrophic breakdown in the transport sector where people have to get a train off a derailment, or it could be in emergency services where a patient is dying in a car accident and you have to extend the shift. But the idea here is that in this regulatory framework, you have the capacity to determine the level of risk and then apply controls commensurate to the level of risk in the situation. Now, what I've tried to do is to go around most of the major regulatory agencies in the world and say, if we take that conceptual framework of green, get on with it, yellow, you need to put some controls in place to keep doing it. If it's in the orange zone, you need to get a lot more in it. And if it goes beyond that level, pretty much nobody allow you to do it. Then you'll find, if you look around the world, that there is actually a high degree of concordance or agreement between many of the regulatory agencies. So what I've done here is I have tried to give you some numbers around this. And what it will show you, for example, here is that there are 5 key dimensions that describe a working time arrangement, and they can be used to determine the level of risk and therefore the level of controls. And generally, if you look around the world, most schedules are considered low risk if they conform with the 5 dimensions that you see on the screen here. That is, they're 45 hours or less in the total hours per week. Shift durations are typically less than 10 hours. Break durations are typically 14 hours or more. You don't work at night. And you get a reset break or a reset frequency, which means a weekend off, which is 2 night sleeps and a day off in between. You get that at least once every 6 days. At the other extreme, you are typically not allowed to go beyond a 72-hour work week, 14-hour shifts, no less than 10-hour breaks. If you do work night work, and if you have a reset break or a weekend, very few regulatory agencies will allow you to have a break less than once per 2 weeks, or once every 12 days plus the 2 nights off, which makes for 14 days. So if you look around the world, you'll typically see that that green zone of what's considered not really a shift working problem, not really a fatigue problem, that is, it's in the green zone, those are the criteria, and then very few people are allowed to exceed that red column. And that's quite useful. But what I'd like to talk about now is how you can use that information. And this is where I'm going to introduce you to a global standard. It's called ISO 31000, which is the International Standards Organization, and there are equivalents of this in the US, Canada, Australia, and there are national standards. They're all pretty much the same. But what they do is they try to understand risk from a structured, semi-quantitative approach. And they say that the risk associated with an activity is a function of 2 dimensions. If we talk about it with respect to fatigue as a hazard, we want to know the likelihood that you are fatigued, and that would be typically rated on a scale of 1 to 5, which goes from almost certain to rare. That is, if you're in the green zone, as I talked about with that last diagram, it would be very rare for somebody to make a fatigue-related error if they worked those conditions due to the working time arrangement. But, and this is an important point, particularly in the US environment, you also have to look at the consequence of a fatigue-related error. Am I going to get a paper cut, or am I going to fall asleep on the job, or am I going to be involved in a multiple fatality? And in the same way as you'll see there, we can go likelihood on a 1 to 5 scale from rare to almost certain. You can look at the consequence on that same dimensional scale of 1 to 5, where the consequence can go from insignificant through to severe. And then to determine the risk associated with a task, you will look at the likelihood of the fatigue-related error and the consequence. And through that process of classifying the likelihood and consequence, you have a highly replicable process for determining the level of risk associated with a particular task. And in this particular diagram here, you will see that it maps onto low, medium, high, and extreme risk, and that corresponds to the color coding in the previous slides. So the idea, if it's a relatively rare likelihood of error and the consequences are trivial, then you would typically see it as a low-risk situation, and that's where we talked about get on with it. There's not a huge issue for fatigue here. On the other hand, as the likelihood of fatigue-related error goes up and the consequence goes up, you can see on the far top right of the diagram that where you have almost certain to make a fatigue-related error, and the consequences will be severe, this would be considered an extreme risk situation. So this provides a nice methodology for people to systematically look at the working time arrangement and the task, and to then classify with a high degree of reliability. It has good psychometric properties, these scales, and then you can decide whether your working time arrangement for the given task constitutes a low, medium, high, or extreme risk activity. Now, once you have done that, and there is very good guidance materials and methodologies for doing that, and we're happy to provide support for people if they want to know more about the details of that. That means that you'll end up categorising the risk associated with the schedule and the task that will be somewhere in the low, moderate, high, or extreme risk. And from a safety management systems perspective, if it's a low risk activity, you don't need any additional controls. Get on with it. It's not, with respect to fatigue, a major issue. But as the risk goes up, so do the controls required in order to continue working safely. We're acknowledging that there is an increase in fatigue, and we're acknowledging there is an increase in risk, and we're saying, however, if you do need to or you do want to continue working, that's okay, provided you put the additional controls in place to manage the risk. So, how do we determine the likelihood that somebody is fatigued? I'm going to refer back to some work that was done by Kirsty McCulloch and I and published some years ago, back in 2005. It's what's called the Defences in Depth model. And it basically says that for any given hazard, such as fatigue, then there is a series of causally linked events that will lead to an incident. This is sometimes referred to as the Swiss cheese model, developed by James Reason, or the Defences in Depth model, as it's sometimes been referred to. But the idea is relatively simple, and we borrowed this purposely from James in order to show that we could embed fatigue within a safety management systems framework. But that is that there is a layer, that a good safety management system will have multiple redundant overlapping controls. And if you go back to this paper, it takes all of the work that's been done in the fatigue area and tries to describe the categories or the different layers in which all of the work around fatigue can be categorised. People may want to go back and look at that in some detail at a later point, but we basically see it as a series of overlapping controls, and that at level 1, that is on the far left, we're looking at the opportunity for sleep, and we're assessing the opportunity for sleep that's provided to an individual. We're looking at level 2, how much sleep that people actually got. At level 3, we're saying, are people exhibiting the signs and symptoms of fatigue? At level 4, we're looking at the fact as to whether people are making mistakes in the task as a result of fatigue. And at level 5, we're looking about whether there are actually accidents or injuries in the workplace that we can learn from. So the idea here is to say that if you have a hazard, as you can see on the left, there will be a series of causally linked events that will actually lead to an incident. So if we think about it from a fatigue perspective, it could be that somebody worked a very long shift, they didn't have enough time to get sufficient sleep. As a result of that, they fell asleep on the job. They were driving a car at the time, so they had an accident. Now, that series of linked events provides multiple opportunities for the organisation to intervene. You could provide the individual with more working time assistance. So you could say, for example, well, we have to make that person less fatigued by not working them so hard. And while that is what you can do, and that's one solution, it's only one of many approaches. You can also say, in many cases, people may be given an adequate opportunity to rest and recover, but they may have been up all night with a sick child. If you use the level 2 dimension here, you can say, what do you have in your workplace to identify not whether people have complied or not with the scheduling rules, but did they get enough sleep or not? in many cases, just saying to people, here's how much sleep you need in order to do the job safely, and if you don't get that amount of sleep, let us know. Now, I know that's culturally challenging in many organisations, but we have seen in the last 10 years in Australia that notion of shared responsibility and how you manage that has been emerging as a very key way of managing fatigue. It also provides the organisation the opportunity to identify fatigued individuals due to factors outside of the workplace. Are people exhibiting signs and symptoms of fatigue at level 3? What systems do you have for people to rate themselves or to observe others? What do you do to look at the errors that fatigue can cause in the workplace and how you might re-proceduralise the working time environment so that people's tasks are less susceptible? If you've worked in the aviation space, there's the work of Bob Helmreich in what's called threat and error management, where they are very effective at redesigning tasks so they are resilient or less likely to result in an error. There's a whole range of ways that you can actually restructure the task and the working time arrangement and the organisation and the human factors elements around all of that in order to reduce the likelihood of a fatigue-related error or to reduce the consequence of it. So, as I said, there are 5 levels within this model. The first model for determining the likelihood of fatigue is to assess the sleep opportunity that you provided people. That is, what is the schedule that they worked? The second level of assessment is what level of sleep and wake did they have? As we go on to talk about a little bit later, the best way to predict how fatigued somebody is to know how much sleep they've had and how long they've been awake and ask them. Now, I recognise that there can be cultural issues about people declaring fitness for duty and all of those kind of issues. But if somebody only once gets asked and puts their hand up and says, yeah, I didn't get enough sleep last night, the organisation then has information on the capacity to respond. Similarly, with level 3, you can talk about signs and symptoms, fatigue behaviour. You will find that there are lots of technologies emerging, for example, in the trucking industry where they have in-cab systems that use either artificial intelligence, computer-aided vision, where they monitor the driver to see whether the driver is on the job or off the job, so to speak, that is falling asleep. So, for those of you interested, I refer you back to the original theoretical work in this area. But what I'm going to do now is show you how we take that James Reason Safety Management Systems model approach. And I'm going to show you here a free app that you can download, which enables you to integrate all of that and then to assess the risk associated with fatigue in your workplace. And then having assessed the level of risk, determine the level of controls you need in order to ensure that people are working safely. Probably better to wait till after the end of the talk, because if everybody goes on the website at one point in time, we'll probably crash it. But if you want to download that, I'm going to take you through now how that app is used primarily in Australia and parts of Europe by organisations to assess the level of risk and how to manage fatigue on a day-to-day basis within their organisations. So, as you'll remember before, we talked about the schedule or the roster that people work and then how to determine the likelihood of a fatigue-related error. You may remember back from that we had 5 key dimensions that determine the likelihood of fatigue or fatigue-related error. As you'll see here that there are 5 dimensions: the total number of hours you work in a 7-day period, the maximum length of the shift that you're working, the minimum break duration that you would have, how many hours of night work you would work in a 7-day period, and the number of days since or between reset breaks, which is 2 nights off with a day off in between, or what used to be called a weekend. Now, it's not perfect, but what you can do is look at those 5 dimensions across the 7 days of a roster or different 7-day periods within the roster, or if you're interrogating an individual worker about their fitness for duty, the last 7 days that they worked. And what we can do is look at the likelihood of fatigue based on the prior 7 days or any 7 days of a roster. So this can be used proactively or reactively. Across the top of the columns, you will see that there are points: +1, +2, +4, +8. As you move to the right on the number of hours in a week or per 7 days, you'll see that the likelihood of fatigue, if you're working less than 36 hours, is quite low. And as you move to the right, the likelihood of fatigue gets higher. So if you're working between 37 and 43 hours, it goes up 1 point. If you're working between 44 and 47, it goes up 2. 48 to 54, it goes up 4. If you're working more than 55 hours, you would get 8 points. If you look at the 7 days in a roster, or the 7 days prior to assessing in the individual, you can rate them on each of these 5 dimensions, and then you can get a score. And that score will indicate the likelihood of a fatigue-related error. Now, for those of you who are good at arithmetic, you'll see that under the best circumstances, you would get 5 zeros, which means you could have a score of 0. And in the worst situation, where you're working more than 55 hours a week, your shift durations are 14 hours or more, your breaks are less than 8 hours, you're working a lot of hours at night, and that you're not getting a reset break very often, you could have a maximum score of 40. So you will get a scale that goes somewhere between the score of 0 and 40. There are very few shift working scores that are less than 5, and there are very few that are greater than 30. We do see them very occasionally, but the vast majority of shift patterns that are worked in the developed world will sit somewhere in that scale of 5 to 30. And then as the likelihood of fatigue goes up, so does the level of control that you would need to put in place. And we've arbitrarily scaled them here. So 1, 2, 3, 4, 5 boxes above the scale, the green, yellow, orange, red, black. And they correspond to the boundary conditions between the risk categories of likelihood on a scale of 1 to 5. So if you look at the working time arrangement, you can assess the likelihood based on the scale that you can see there. So green is a 1, a yellow is a 2, an orange is a 3, a red is a 4, and a black is a 5. If you look there, based on that analysis of the working time arrangement, we have now calibrated the scores based on ISO 31000 into that range of rare to almost certain for a fatigue-related error. And you'll see there on that scale of 0 to 40, 0 to 5 is a 1 in terms of likelihood, 6 to 11 is a 2, 12 to 20 is a 3, 21 to 25 is a 4, and if you get a score of 25 plus, it's 25 plus, which means that it's a 5. That is, people will be almost certain to make a fatigue-related error based on that working time arrangement for the typical tasks that people do. Now, that tells you the likelihood of an error, but it doesn't tell you the consequence of an error. And here lies part of the challenge for organisations. You need to look at the tasks that people are doing in situ, because some people may be working in an office and the risk, even though the likelihood of fatigue is high, the consequence of a fatigue-related error may be low, and other people may be operating a jumbo jet. But having classified a task, and there are good guidance materials to help you do that, you can look at the likelihood based on the working time arrangement, you can look at the consequence of a fatigue-related, and then by connecting on the matrix there, you can work out if the likelihood is a 3 and the consequence is a 4, it would be considered a high-risk activity. Having done that, every working time arrangement and task can be classified on that scale of low, moderate, high, or extreme. And then within the organisation, we would then have the risk mitigations that are required by the organisation in order to continue to work safely. And this one's a little bit hard, but this matrix here will show you the risk classification on the left, low, moderate, high, or extreme, and then what I would call the general classification of the mitigations required in order to continue to work safely. I have borrowed some stuff here for some work we did for Virgin a few years ago. They're a kind of a groovy organisation and had some nice ways of thinking and communicating with their employees. And they said if it's a low-risk working time arrangement and task, and you're in the green zone, you're good to go. So you don't have to do anything else unless somebody indicates to you based on a higher level assessment that there's something else wrong, i.e. based on the working time arrangement and the task, you should be good to go most of the time. On the other hand, as the risk goes up, they then classified that if you're in the moderate zone, you needed to look after yourself. So they said there's a minor increase in the likelihood of fatigue-related risk. For them, notify your co-workers and supervisors, and they institute what we call self-management controls. And that usually means things like self-monitoring. Hey, the risk's slightly higher, I need to keep an eye on myself. It might involve using standardised interventions such as increasing task rotation or self-paced workload. So, for example, when we did this with Virgin, they would do the risk assessment, and then if it was low, you just took off. But as the risk went higher and higher, the level of controls that needed to be put in place went up. If you got to the high risk level, it would look after each other. That is, it wasn't just self-monitoring, you declared it to your co-pilot, and then you operated in what we call fatigue mode. So they said there's a moderate increase in the likelihood of fatigue. You did notify your co-workers, so they know. And the work we did with Qantas many years ago in the simulator shows that it's very clear that people, if they tell their co-workers that they're fatigued, their co-workers are more likely to detect and prevent fatigue-related errors because they're watching them. So what you will see here in the high-risk area is that there will be pre-existing team and process management controls which will usually be sufficient, and that may be as simple as increased supervision or task reassignment. So, for example, in the coal industry in Australia, the people who operate the drag lines, if they get into the higher and extreme area, they may not work, they're not permitted to work on the drag line that night, but they can go and do other activities that have less consequence as a result. So they may manage the risk not by reducing the likelihood of fatigue, but by giving them a task that reduces the consequences of a fatigue-related error. Now, that does require that the organisation has some multi-skilling strategies, but in the coal industry in Australia, the guys who work the drag lines are the big men in town, and there's always a long list of people who want the opportunity to try. So in that situation, we used a multi-skilling strategy that enabled people who were fatigued to not work, and they would do something else in the workplace. They could do a training exercise with other people. They might work in repair rooms. They may work in a maintenance task. They may do other activities, but somebody else would go and operate the drag line because we knew the consequences were high. So you can see here that we have a very structured approach to determining the likelihood of fatigue, determining the consequence of fatigue, assessing the risk, and then determining the controls that go into place. The next thing that we try to do is to say the working time arrangement is fine, but just because you give somebody an opportunity to sleep doesn't necessarily mean that they'll use it. There can be a variety of reasons why a break may not be converted into sufficient sleep in order to return to work fit for work. So in addition to looking at the working time arrangement, we also assess the individual based on what we call their prior sleep-wake history. Now, this is a very simple heuristic that asks the individual a couple of questions that are usually pretty easy to answer, and then it will determine the likelihood of fatigue-related error in the same way as we did based on the working time arrangement. But here we're looking at the individual based on the last couple of days. So if you want to know how fatigued somebody is, you need to know how much sleep they've had and how long they've been awake. So what we do is we ask people how much sleep they've had in the 24 hours prior to starting work, how much sleep they've had in the 48 hours prior to starting work, what time they woke up, and how long they will have been awake at the start and then by the end of the shift. And the app will do this all for you, but for those of you who are interested, there's some work that was done in that paper I referred to you earlier, which sets the thresholds for the amount of sleep that people need in order to work safely. And in the same way as we do for drugs and alcohol, we provide guidance in Australia to employees to say, how much sleep do you need to do the job safely? And in the same way that people vary in the amount of alcohol they can drink, we also understand that people vary in the amount of sleep they need, but we do try to provide people some guidance and say for most people on most tasks, once you get less than 5 hours of sleep in the prior 24, your risk of an accident doubles. And if you get less than 12 in the prior 48, the same thing happens. The other thing is once you've been awake for longer than the amount of sleep you had in the prior 48 hours to starting work, that is, sleep buys you wakefulness, then also once you've been awake for a certain amount of time, then the risk starts to go up. What the app enables you to do is to answer a couple of questions, and then it will give you a score that ranges somewhere between 0 and 15. And you'll see here on the left a repeating theme. That score, based on your prior sleep-wake, enables us to classify the likelihood of you making a fatigue-related error based on your prior sleep-wake, not just your working time arrangement. So this is a very effective tool for assessing a given individual on a given day, in the same way as you might say in a drug and alcohol policy, don't turn up to work under the influence of alcohol and hope that people will comply. This is the equivalent for fatigue. Here's how you can work out whether you're fit for work or not. So you'll see here, having used the calculator, you enter and answer a bunch of questions about how much sleep you had in the prior 24 and 48 hours, what time you woke up, what time you start work, what time you finish work, and then it enables you to calculate a fatigue likelihood score and to predict that into the next 24 hours. So you're able to say not only how likely am I to be fatigued now at the end of the shift, but for the next 24 hours. So if your shift has to be extended, that information could be used by you and your supervisor to inform the decision making. Again, as we've said before, you can see that there is the green, yellow, orange, red, black, the 1, 2, 3, 4, 5. So we've calibrated that for you in the same way as we did for the working time arrangement. So on the third column here, you can see using what we call the the personal fatigue likelihood score, you can see the likelihood based on the ISO 31000 rankings of 1 to 5, how likely it is that an individual, based on their prior sleep-wake record, will make a fatigue-related error. And you can see there, if their score is 0, then it's rare that they would make a fatigue-related error. If the score is 1 to 4, 4 to 8, 9 to 12, or 12 plus, there's an increasing likelihood. Now, again, depending on the task that they're undertaking, you will see the same methodology that we've used before. That is, calculator, again, provides you a likelihood for that given individual on this occasion, based on their prior sleep-wake, the likelihood that they will make a fatigue-related error, based on the consequence of a fatigue-related error in the task they're doing, and that could be driving a car, landing a plane, or operating a photocopy machine. You can determine the level of risk associated with that, and then having done that, the controls go into place. So you'll see a repeating theme here of a risk assessment based on likelihood and consequence. Having done the risk assessment, you're clearly determined about what controls need to go in place in order for somebody to continue to work safely. Now, it's important to note here that the controls will be quite task-specific for different work groups. So what works for truck drivers in terms of the controls would not be the same as that you might have for somebody who was a dispatch operator or somebody who was loading the trucks. So there's usually within organisations a process of talking to people and say, what are the things that you do or can do or could do to control the risk? It's beyond the scope of today, but what we have found is if you go and talk to people and say, what do you do when you're fatigued in order to prevent an error, people will tell you all the stuff that they do. Most people working shift work have a lot of experience of working fatigued, and they have workarounds for how they control the risk. And through a combination of looking at what other people in other industries have done to do it and talking to your own people, you can identify the kind of adaptive controls that enable people to reduce the risk. Now, we've looked through level 1, which is the working time arrangement, We've looked at level 2, which is the amount of sleep and wake that an individual is experiencing. The third thing we look at is the signs and symptoms or behaviours or self-assessment of fatigue. And to do that, we use a well-established and validated scale, and you can see that there on the left, which simply asks people to rate themselves on a scale of 1 to 9 what their level of fatigue is, and it goes from a score of 1, which is extremely alert, through to a score of 9, which says very sleepy, great efforts to keep awake, fighting sleep. Now, why do we use this scale? There are a couple of reasons for it. It's in the public domain, but the most important reasons are that it's well validated and well calibrated. We know the scale works. We know it's an accurate predictor of fatigue likelihood. And we also know from lots and lots of studies using this scale at what point for lots of different tasks people are likely to have an accident. So we know, for example, based on the driving simulation literature, that once people have a likelihood score here on the Karolinska sleepiness score of 8 or 9, they probably shouldn't be driving because their risk of having an accident while driving has gone up unacceptably high. It's a great scale because it's well validated, it's in the scientific literature, it's legally and scientifically defensible, and the last reason is it's free. You don't have to pay expensive consultants a lot of money to do it. It's embedded within the app, so it's easy for you guys to use. But again, we have calibrated this scale back against the ISO 31000, and you'll see here in the last column on the right that the Karolinska Sleepiness Scale score that you get from an individual employee can be calibrated against the ISO 31000 likelihood scale. So Karolinska score of 1 means that it's rare that somebody would make a fatigue-related error. On the other hand, if they have a score of 8 or 9, then it's almost certain that they will make a fatigue-related error. Again, depending on the task that the individual is undertaking, you would look up the likelihood, you'd look at the consequence, you would categorise the level of risk, and then for that organisation you would go back and, as we've said, put in place the controls necessary in order to continue working. It is important to note that sometimes the level of risk will be so high it's unacceptable for the organisation, and you may say, you need to stop work or you need to stop working at that task and do something else, or catch a cab and go home, or whatever the best and most appropriate control is. So, for those individuals who are still listening to us, what I'd like to suggest is that this is a very structured way of managing fatigue. I think it's a very realistic way of managing fatigue for a couple of reasons. The first reason is that it's highly replicable. So it gives staff and supervisors a very clear process to follow. We notice, for example, that when somebody comes in and we do a risk assessment with them based on their prior sleep wake, and we know that people can lie to us, and we'll talk a little bit about that later, I suspect, that we have a conversation that's not where somebody has to put their hand up and say, I'm tired, because that's really hard for people to do, but somebody will come in and say, I haven't had sufficient sleep in order to work safely. There's a real difference in the way that sounds and the cultural way that that's interpreted for organisations. In those situations, we find that people, if they are given a structured way of managing fatigue, people will do the right thing. So my suggestion is that when you're starting to think about how you might implement these kind of approaches, the big attraction of this is that it is structured. It enables people to have clear conversations and to come to clear decisions about how they manage the risk on the day. And certainly if somebody puts their hand up 5 days in a row, then there needs to be a, what we politely call a root cause analysis and a conversation as to why is it that you're not getting enough sleep? Is it because we haven't provided you enough time to get a decent sleep, or is it because you're doing something else? So again, one of the advantages of this approach is that it provides a highly structured way for organisations to interact with their individuals, to assess the risk, to work out what controls need to be put in place in order to continue working, and in the event that it is continually unacceptable level of risk, that something needs to change. So I'm going to encourage you to think about some of the ideas that are put forward. Some of them are going to be challenging. Some people say, I thought I was just going to get the schedule that would solve the problem. I'm sorry, if I knew the schedule that solved the problem, I'd probably be a very rich person by now and not having to talk at 4 o'clock in the morning. But what I would suggest to you is that while this may seem a little bit complicated, organisations have been doing this around the world for about 10 years, and it works really well, particularly for those organisations where not working isn't really a politically or economically viable approach. But it also provides you with a very legally and scientifically defensible methodology for why you allowed the person to continue to work and what controls that you put in place in order to ensure that they were working safely. And again, this would be embedded within a safety management system, and there would be a process of review and are the tools working and are people trained appropriately in their use and all of those kind of things. So I'm going to encourage you to have a play with this, think about some of the ideas. The instinctual response will be no, but that's okay. Push through that and see if you can have some interesting explorations and discussions with people at work, particularly around what do you do when you're fatigued in order to reduce the risk. So, Imelda, I'm going to stop there and say let's talk about maybe having some questions, and thank you all very much. I hope some of this has been useful.
Great. Thanks, Drew, for a very interesting and thought-provoking presentation. And again, thank you for joining us or presenting so early in the morning from Australia. I'd like to thank all of you for your participation. This webinar will be posted on our NIOSH Work Schedules webpage for future reference. You can also sign up for future seminar announcements on this page. And I hope that you can join us again for the next installment of the NIOSH Director Seminar Series on working hours, sleep, and fatigue. Thanks, everyone.